Hi, everyone. Thank you for joining us today. We will be starting very shortly. We're just going to give people a little bit more time to join. We'll be back in just a moment. Good evening, everyone. My name is Nina Agustin Rodriguez. I'm a physical therapist and clinical director at our Times Square location. I'd like to welcome back those of you who have attended one of our other webinars, as well as welcome those of you who are joining us for the first time. We appreciate you taking time out of your busy days to learn with us. For those of you who do not know who we are, Sphere is a private outpatient practice that has been around for over 20 years. We currently have 25 locations located all over the New York City area. We have successfully continued to offer in-person care through the COVID-19 pandemic, along with launching Sphere Live for those who are looking to stay in and receive care using our telehealth platform from the comfort of your home. In our clinics, we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone. You can find more detailed information on those safety measures by visiting our website at spherecenter.com. We are here for you in whichever way makes you feel most comfortable. If you are looking for individualized care, either in the clinic or through telehealth, please reach out to us at your convenience and we'll get you set up for an appointment right away. We are excited to be with you today to discuss the most common dance-related injuries in ballet and modern dancers, risk factors for injury, and the benefits of cross-training to reduce injury rate. As you can see, we are coming to you live from various locations and Sphere clinics, and although we do not anticipate any technical issues today, please be patient with us should any arise as we navigate working through this technology. Throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. To find where that is, please take a moment to hover your mouse at the bottom of the screen where you will see the Q&A option pop up. That is where you will be able to click questions, and we'll do our best to address as many of them as we can during the webinar. It is best to put questions in the Q&A. If you put questions in the chat feature, we will likely be unable to get to them during this webinar. For those of you who are watching through YouTube Live, we are monitoring the comment section there as well. So please feel free to type your questions in. Lastly, there will be times where multiple panelists are on the screen. So for the best viewing experience, please select Gallery View at the top right corner of your Zoom screen, so that you'll be able to see multiple panelists at the same time. All right, so let's talk more about our goals for the day. We will discuss the risk factors that specifically contribute to various dance-specific injuries. We will recognize the most common dance-specific injuries incurred by ballet dancers. We'll do our best to differentiate between soreness and an injury. And then we'll also demonstrate some exercises correctly targeting at some core stability and lower extremity strength to reduce risk of injury. Before we get started, I'd like to introduce to you our team of panelists. Our presenters today are Brittany Chan and Allison Ventola. Both are physical therapists at our Times Square location in Manhattan, and Jamie Kinkler, physical therapist and assistant clinical director at our Chelsea office, also in Manhattan. She will be helping us with our Q&A today. Just a reminder to everyone, it's best to be in gallery view so that you can see everyone at the same time. And if you've done that, you should be able to see all of us right now. All right, let's get started. Jamie and I are going to say goodbye for now. Allison, take it away.
Hi, everyone. My name is Allison. This is Brittany.
Hi, everyone.
So we are going to start and dive in. So why are dancers so susceptible to injury? So dance, as we know, is a physically demanding athletic art. Not only that, but it's a sport, and it requires extreme strength, flexibility, endurance, etc. And so dancers undergo rigorous training, like sometimes daily, 5 to 7 days a week at least, right, to achieve mastery of various movements, and they continue to push themselves to the limits. So this predisposes dancers to various types of injuries. And then dancers don't really get a break, right? So you don't really have an off season. There's not a ton of time where you can rest. So because of the little recovery time, sometimes that predisposes dancers to overuse injuries, and we'll jump into that a little bit later. But yeah, so there is also an aesthetic requirement to dance, which is very unique to performing arts in general. So, you know, you always like to ask about nutrition and hydration and make sure that everyone's on the same page. And then just keeping in mind that, you know, if you're a dancer who dances 1 day a week, or if you're like professional, let's say you've danced your whole life, you technically specialize, right? If you never did anything else but dance, you're constantly working your joints through a specific ranges of motion regularly. So that predisposes these tissues, like such as muscles, tendons, ligaments, to more strain and increased stress and load.
So this is kind of a list of the incidence of injury in ballet and modern dancers. So as you can see, for ballet dancers, most of our injuries are usually in the foot and ankle, partially being from dancers being on point all the time or doing a lot of bar work where they're on releve, turns, jumps, all that require a lot of stress on that foot and ankle. And here at Spear, at our Performing Arts Center, I feel like a lot of the dancers that we do see, especially our ballerinas, are either a foot or ankle. We also see common hip injuries, such as kind of like a snapping hip syndrome, or if we see a lot of labral tears, also due to a lot of lower extremity injuries from being on your feet for a long period of time, and all the stress that is required for us to do these big jumps and turns. Same thing as the knee. And then we also see a good portion of back injuries as well, because you're required to have so much hyperextension in that back with all of our extended lines when we dance. For modern dancers, it's pretty similar, actually. We have the greatest percentage of injuries being in that foot and ankle, a little more in the back in modern dancers compared to a ballet dancer. And we also see a lot of high incidence of knee injuries as well.
Okay, and so this slide just kind of gives you a general outline of common dance-related injuries that we typically see, at least in the clinic, but it was also cited in the article that we kind of base this off of. And so in the back, you have spondylolysis and spondylolisthesis, which is this fancy word for like a fracture of like a particular part of the vertebrae, and then the listhesis is it moving forward. And sometimes that can cause pinching or pressure. And it's commonly seen in dancers, gymnasts, any sort of sport or art that requires hyperextension. And then in the leg, we typically see stress fractures, and you could see it in the tibia mostly, but also sometimes the fibula, femur, and pelvis. But usually that like shin splint is usually what we see most commonly. And then in the hip, we have, like Brittany mentioned, snapping hip syndrome, which is just like if you're doing a développé and all of a sudden your hip clunks, or you're getting some sort of like clunkiness or clickiness, and you're like, why does it do that? That's snapping hip syndrome. Hip impingement is just a fancy term for like, something is pinching in my hip. It could be when you're sitting, it could be when you're doing various movements, could be due to soft tissue inflammation. Labral tears, we also see, and it kind of can present similarly to impingement, but Labral tears, it's just like a cartilage ring around the socket, and it just vacuum sucks the femur into the joint. And so sometimes if there's a tear, you can get some clicking and clunking, but nothing a little peachy can't fix. And then you can get tendinitis, your typical, tendinopathies, any sort of pathology of the tendon from just overusing those particular muscles for a long period of time, over and over again. And then bursitis sometimes presents the same way as a tendinitis. So we treat both of those. And then sacroiliac joint dysfunction or your butt joint. We also see some sort of sometimes we see instability, sometimes we see hypomobility, or it doesn't move enough, stuff like that. And then in terms of the knee, just generalized, knee pain, we see a lot of hamstring strains from, doing those big leaps and jumps and, grand mamas. And then meniscus tears sometimes can lead to a pinching or pain in the knee. And then for the foot and ankle, like we said, it's the most common stuff that we see in our performing artists. So we, a lot of dancers present with Achilles tendinopathy, particularly bothers them with jumping. And then there's another muscle, lesser known, but it's called the flexor hallucis longus, and it points to your big toe. And so the sheath, or every tendon has a sheath around it, and sometimes buildup of fluid in that sheath can lead to something called tenosynovitis. So it presents kind of like a tendinopathy, but it can cause some pain on the back inside of your ankle. So that's typically how we differentiate that from more of an Achilles, it hurts on my heel, at the, where the calf muscle attaches to the heel. And then ankle impingement, it's pinchy. It could be in the front, it could be in the back, and we treat that as well. And then of course your typical ankle sprains where, you roll it walking on the sidewalk or, what may have you. And then we just want to make a note of places where you can get stress reactions. Sometimes it could present like a dull, achy pain that just gets worse over time. And so common sites of that, especially in dancers, are the metatarsals of your feet, the tibia, because it's the weight-bearing bone of your leg, sesamoid bones, which are like two little baby bones underneath your big toe, the base of your big toe, and then the low back or the lumbar spine. Okay. So then it's important to differentiate, sometimes we get asked the question oh, this is always sore. So is it an injury or am I just sore? And so what me and Britt tell people is that soreness usually subsides within 24 to 48 hours. It's gone, it doesn't persist. The pain doesn't wake you up at night if it's soreness. And it could be present at the start of an activity, but any sort of pain that's present the whole time or present at the start or increases with the activity or makes you compensate in any sort of way in dance is typically not soreness. So the pain, the 4 bullet points that we have listed are things to keep an eye on in terms of more of a yellow, a yellow to red flag of this could be an injury, right? Anything that wakes you up at night. And what I just said before about anything that's present the whole time or makes you compensate.
So this slide talks a little bit about the risk factors for injury, and this is a separate article from the one that Allison and I based a lot of this PowerPoint on. And basically, it was saying these are 4 areas where the article, it was a randomized control trial, so they had dancers who didn't have an injury and had dancers who had an injury in the past, and they were kind of comparing the two and see what are the risk factors for one group and why are these dancers getting injuries compared to the other group who haven't gotten injuries in the past. And these are 4 categories where they found some differences in. One being posture. A lot of people with foot pronation, it says right in this article, but it's both feet. If you're more on that flat-footed side, it just puts your foot and ankle in a position that is not ideal for some of the stresses that's required from dance, like going up on your toes, coming down, especially with that landing. Strength and flexibility, they found that a lot of times dancers who had impaired strength compared to dancers who we'll talk about in a second, who do cross training and have stronger muscles, are more at risk for injuries. There was also a qualitative part to this study. The numbers in terms of, they did manual muscle testing to see what is this dancer's strength out of 5 compared to this other dancer's strength who didn't have an injury out of 5. Those are the quantitative data that they got from the study, and it showed that the dancers who were weaker were more prone to injury. However, another thing they actually did in the study was actually they had a qualitative section where they asked every participant whether they were had an injury in the past or didn't have an injury in the past, and they were trying to see what did you benefit most from this program. And a lot of them stated that they benefited from improvements in core strength, which they didn't focus a lot on in terms of their dance classes. It was all basically their lower extremity strength. They were all using their legs, and they found that a lot of times their quads were nice and strong, but they didn't have the core strength available to them. So that's one area that they benefited from in terms of strengthening. Orthopedic testing, they found that a lot of the dancers who were getting injuries had poor ankle plantar flexion, so kind of going up on their toes in releve and back down. And you think about all the dance activities that we do on releve or when we're jumping, even the landing for that part, they found that everyone had difficulty kind of controlling that landing down. More of that eccentric control, meaning the muscle is still lengthening, but you still need it to prevent it, to fire that muscle to prevent it from kind of gravity taking everything down at once. And that's when they found a lot of these dancers were getting kind of an Achilles tendonitis because they weren't having that strength in that calf, especially during that lengthening phase. And lastly, one of the other areas where they were just looking at their dance technique function. And one thing I found interesting about this separate article was that they looked at standing leg turnout, how they were kind of moving their leg in turnout, plie alignment, developé test, and a releve balance time test. And surprisingly enough, they didn't find any significance in that with the dancers who had an injury versus those who didn't. But we can argue, obviously, that if you have better form with all of your dance activities, then you are less prone to injury. But that was an interesting thing I found about this article. For this one, this is the separate article now, and kind of how we talked about cross-training in the past, and how Allison kind of talked about it in one of her prior slides about how a lot of dancers don't want to do other exercises in terms of strengthening. They do a decent amount of cardio, but a lot of people are afraid of strengthening. Main reason being they don't want to build any unnecessary bulk because everyone wants that slim figure. So this study kind of wanted to see, it was based on professional ballet dancers, and they wanted to see if we can see a difference in terms of muscular strength, coordination, agility, speed, and motor control. And they did all these tests for that and see if there's an improvement in that after everyone participates in a cross-training program. Cross-training incorporating strengthening exercises, some agility exercises, plyometrics, some stretches. Are these dancers going to benefit from that? And they hypothesized that those who participated in this program, they would reduce their injury by improving all these things: their motor control, their stability, their balance, and just their physical function in general if they kind of participate in the strength training or this cross-training program.
Okay, so the methods were that 6 professional classical and contemporary ballet dancers completed a 5-week conditioning and injury prevention training program. So not a lot of people, but they still did it. So they took a 30-minute class 2 times a week for 5 weeks. The first session was taught by an orthopedic certified PT. And then the second session was taught by a dancer liaison who attended the class earlier in the week and watched the whole thing. So the program consisted of warm-up, some agility training, plyometrics, and strength training. And some exercise examples are bridges, planks, single leg deadlifts, lunges, squats. I'm sure you guys have heard a lot of these things, such as step ups and jumping. And the progression from those things is to progress to more dance specific movements, which obviously, as we know, requires a lot of more single leg stuff. So this is kind of like the stepping stone in the beginning.
So these are the results of that study, and they did a pre-test study and a post-test study. So seeing what the results were in terms of the numbers, or what their muscle strength was, what their balance tests. There's numbers for all of these kind of tests that we do, and they looked at the numbers before they even started this cross-training program, and they looked after they finished this 4-week program. And so they found that from those post-test results that they have an improved modified star excursion balance test, a single leg hop test for distance, which is another one we like to use, the balance one, and then one to see kind of like their plyometric muscle strength. And then lastly, their upper extremity closed kinetic chain test, all improved after this program. This program also incorporated both legs and upper extremity strengthening exercises, so it wasn't just for the legs, even though as we discussed previously, most of their injuries were from the hip, knee, and ankle. Then they did a study 4 months later. So right after they finished this 4-week program, they're like, what happens after these dancers have kept up with the program 4 months after? And they found that the dance functional outcomes survey score has remained the same. And then for the single leg hop for distance test and the modified star excursion balance test, those improved. So that was one thing that was actually I found pretty interesting too, because even though these dancers, and we talk about dancers not having time to do any of these exercises because they're always focused on dance and rehearsals and performances. But even after 4 months, people found that the gains that they made from this cross-training program stuck, and it reduced their injury rate based on these kind of functional scales and scores.
Okay, great. So like we talked about before, so some of the exercises we focused on strengthening exercises today, just because they're a little bit easier to demonstrate. But so you always want to incorporate this in like any sort of cross training, right? There should always be a warm-up phase. There should always be strengthening, agility, and plyometrics, but you should also always cool down, of course. And so we are going to get started with a little bit of a demonstration. We picked a couple exercises and we're going to show you them and describe kind of a little bit about how to do them correctly so that you're working the right stuff. Okay.
All right, we're just going to take a few seconds to get everything settled.
Okay.
And Allison is going to be demonstrating the first skill. All right, can everyone, no, this doesn't look, yeah. Can everyone see Allison? All right. So the first exercise Allison will be demonstrating is a bridge. And I'm sure you've all done bridges before, but Allison, I'm gonna have you do a bridge for me. And what Allison is doing is this is gonna be a glute emphasized bridge. There are different ways to do a bridge. You can do a hamstring bridge, you can do a glute bridge. I find that a lot of my dancers are weaker in the glutes than they are in the hamstrings. So this is going to be a glute emphasized bridge where Allison kind of squeezes her booty. She lifts her hips off the floor. A lot of times people don't feel it in the glutes for this. So one cue that I like giving to is to kind of squeeze the booty cheeks together before they lift up. Another cue I like to use as well is to think about pushing their heels down towards the mat to lift those hips up. Because a lot of times people like to either slide their heels closer to their butt and emphasize a little more of that hamstring to help out. But I'm going to have her think about pushing down into the floor to lift those hips up. So also, one other thing that I've noticed with a lot of my dancers is their quads are really, really tight. So sometimes they feel this all in that quad. Which is not a bad thing. They feel a stretch with it, but I find it beneficial sometimes to have them do a little quad stretch before they do a bridge. That way they feel it a little more in the glutes. So Allison is just going to demonstrate about 10 more bridges for you guys. And if you guys are not feeling it, or if this is too easy for you guys as you get a little more advanced and getting stronger, you can add a band as well. So Allison is now going to put a band around her knees to add a little bit of resistance to it. So she's on her back, she's thinking about pushing out into the band as she lifts those hips off the floor and then coming back down on the mat. And usually I like to do a 2-second hold at the top, and then I like coming down slowly and controlled. So you're not just letting gravity take all of that weight down. Awesome. We're going to do around 5 more. Perfect. And usually I like to start off with around 10 and then asking my patients how they feel, where they're feeling it, and then making adjustments accordingly. So if they're feeling like they're getting fatigued or if they're compensating in different ways around that 5-6 mark, we'll adjust accordingly and try to give them those cues again. And then they can do another set of 10 and try it with those minor adjustments. The next exercise Allison is going to demonstrate are clamshells. So Allison is going to lie on her side now, and you can do clamshells with or without a band. So we're just going to use the band for demonstration here. So Allison is lying on her side. Her knees are bent and her hips are brought forward, so her knee is closer to her chest. And now what she's going to do is, while keeping her heels together, she's going to open up with that top leg. So the top leg is pointing up towards the ceiling and back down. Once again, up towards the ceiling and back down. And these are important for dancers too, because it works on our hip external rotators, which is what we're using for a lot of the activities we do when we're dancing. Especially when you're bringing your leg up into kind of passe. When we're turning, we want those hip external rotators to turn that hip out. We want it to be nice and strong the entire time. So what she's doing here, and a common mistake that people make as well, is they want to rotate with that lower back. They want to use those lower lumbar rotators to help them out. So she's doing a good job at keeping everything nice and stacked. So basically her low back is not moving and she's just isolating it at the hip. And then I like to ask my patients after a few times where they're feeling it, just to make sure they're feeling it in the right place. So Allison, where are you feeling this?
Right here.
Right in the booty.
Yeah.
We say booty a lot here in the clinic because we're all dancers, and I feel like that's just a thing that we commonly say. Exactly, the technical term. Good. And then for this, I always like adding a little band for all of my dancers just so they feel it a little more in the hips. But obviously, if this is too difficult for you, you can take the band off or lessen the resistance in your band so until you feel it in the right place in the glutes. All right. The next exercise we'll be doing for you guys is one of our core exercises. So kind of how we stated before about how I find that a lot of my dancers are very weak in their core, and that's one of the things that they specifically wanted more of in that qualitative study where they asked dancers after they did that questionnaire. They were all given a questionnaire after the cross-training program, and they found that they benefited most from all those core exercises. So Allison is going to demonstrate an exercise called a dead bug, which we love here in the clinic. So she's going to go into on her back first, and I want Allison to think about her back flattening onto the floor. So your back is flat the entire time. This engages some of our deeper abdominal muscles. So what she's going to do is, while keeping everything flat, she's going to alternate arm and leg. So she's going to kick out with one leg, and as she's doing that, the opposite arm is going back towards above her head. Then she's going to switch sides. And I usually like holding it for around 2 seconds before coming back, just to make sure all of your muscles, all your abdominal muscles are engaged for this. And if this is too hard, there are variations we can do for this too. The main thing is we want your back to be flat. We want the right muscles to be engaged. So different things that we can do is we can do a little dead bug march as a little alteration. So bringing, instead of using our arms, we're doing one leg down at a time. Good. And then the other leg, just to bring the distance a little closer to the core. So instead of lengthening everything and bringing everything away from the center, we're just doing the legs now instead of alternating the arm and the leg. And another thing for all of my abdominal exercises that I like to ask my patients, and it's harder nowadays to see with the mask on, but to make sure that they're breathing. A lot of times when people do abdominal workouts, they like to hold their breath, especially as they're pushing that leg out. So making sure that Allison exhales as she's pushing that leg out during that exertion phase. Again. And these are usually a little on the harder side for an abdominal workout. So I like telling people as well, we can break it up. Once you feel like you're starting to compensate, we want to take a break. We want you to work the right muscles. So even if we do a set of 8, 3 times, I rather them do that, especially if you have back pain, trying to do it correctly instead of kind of hyperextending your back with these exercises, which is just going to contribute more to your pain. All right, we're going to get to the next 3 exercises. I'm going to switch spots with Allison and I'll demonstrate the next 3.
Okay. All right, so for the next 3, the setup can remain the same. So all you need is a mat or something comfy so that when your elbows are on the floor, they're not like digging into the ground. So the first thing we're going to do is a standard forearm plank. And so Brittany is going to come up on her elbows. So her forearms are on the floor. She's engaging her core and keeping her hips level, and she's going to hold for 30 seconds, 3 times. Okay. So that's the typical dosage for something like this. I know like some of you probably do like 45 second planks, or, can do it for a minute, but just really make sure that you're breathing through it and make sure that you're engaging the right muscles. So you want to make sure Brittany is doing a fantastic job. One thing we see is as time goes on and as the reps increase, we start to see this sag in the low back. So we start to see low back arching. And so that's when you want to make sure that you pull your hips back up, and then keep them level. And then the other cue is you don't want any sort of tension in your neck. And so what you want to do is you want to push those elbows out. You want to push the floor away from you the whole time and make sure that you, maintain that position so that you're not experiencing any sort of like pinchiness in the shoulder or any sort of issues there. Because we know that as dancers, we have to like move our arms through big range of motion. So sometimes they're a little bit unstable. So pushing out is a really good way to stabilize the shoulder as well. So we love this for like full body core workout. Britt, you okay?
Yeah, my core's on fire.
Okay, she's gonna take a break because her core is on fire, but lucky for her, the next exercise is actually a modified side plank. So it's also called side plank on knees, whatever you want to call it. And so basically Britt is going to be, her knees, hips, shoulders, and head are all in one line as she does this exercise. You really want to make sure that the elbow is underneath the shoulder so that it's not too far out, because that'll place stress on and pressure on the shoulder as well. So you really, as Britt pushes up, she uses her bottom glute, the side glute. So like if you do clamshells before this, you might feel like it's on fire. But she pushes her bottom glute up to lift her hips at the same time that she presses the floor away with her forearm and her elbow. And she's just gonna hold for 30 seconds, 3 times. And you want to make sure the one compensation I see here pretty commonly is people arch their low back. So the same kind of, we call it like lumbar extension, but like low back arching. And that's a common thing. So Britt, you can show that. Yeah. So that starts to happen. And so what you want to really cue or keep in mind when you're doing this stuff is to just make sure that your body is in a nice flat line. And so that there's no sort of rotation of the back. And so doing this in front of a mirror, dancers love mirrors, we love them. So just looking at yourself in a mirror if possible as you do these. And you always want to do both sides, clamshells as well. Like just because your right hip hurts, I would, for like the clamshells that we were talking about before, you always want to do both sides, just to even you out and make sure that there's no sort of like discrepancy or difference there. So Britt is just doing the other side. Her form looks good. You can kind of see how in line she is. Everything is nice and in line. And then, yeah. Okay. Good. So that's more for like the obliques and the glutes and like the side core muscles versus the standard plank is more for, it's for everything, but it's especially you'll feel it in your core. And then the last thing Brittany is going to demonstrate for us is she's going to be on her hands and knees. and she's going to lift her back leg up with her knee bent, and then she's just going to kick her heel, flex her foot and kick her heel up to the ceiling. And the motion can be super small. What you really want to make sure is that Brittany does not overarch her back. So sometimes what I like to do is I like to put a pillow on people's backs just so that you can feel whether or not your pelvis is starting to go. And Brittany is doing a really good job of keeping her wrists underneath her shoulders. She's doing a good job of keeping that neutral pelvis, so not too tucked and not too arched, right? So Brittany, do you feel your core right now? She does. So yeah, when you're doing this, you can do 3 sets of 10, 2 sets of 10, really gauge it. As dancers, you know, you're aware of your body. So if you start to feel stuff getting funky, or you're like, I don't know where to feel this, you should be feeling it in that glute. So if you feel too hamstring, sometimes what we do is we have you, we place a ball in between the like right here. So if you saw that, and we place a ball there to just kind of like shut off the hamstring so that the glute can do most of the work. And then Britt, you can switch sides if you want. Great.
Our booty's on fire.
Her booty's on fire, everyone. Take note, it works. And then, so this is a good core stabilization one as well, because you can really see how she has to engage her core in order for this exercise, in order to feel this exercise properly. Otherwise, her whole pelvis is going to tilt and cave. So Brittany is doing a great job.
Do you see the shake?
I do. Do you guys see the shake as she comes in? Brittany wanted you guys to know that. Okay. All right. Good job, Britt. Okay. Okay. Wonderful. All right. So that is what the little demonstration that we prepared for you. We thought it'd be nice and easy because you can just really do it with a mat. And so, okay. So we have some questions.
Hey, Britt. Hey, Allison. Thank you so much for your lovely presentation. So we do have a few questions. Nancy had asked, where do you place the ball on the donkey lift? Would you mind showing that one more time, Brittany?
Yeah.
Yeah.
You can focus it as well.
Yeah. Yeah. We will demonstrate with this pillow, I suppose. Okay, so the audio is over here, so I'm just gonna kind of stay over here, but Britt, can you just put the pillow between? Yeah. So the ball is going to be between your calf and your hamstring. So it's going to be right behind your knee, and you're going to squeeze the ball, which will turn off the hamstring, so that when you lift, it's easier with the ball, but when you lift up and down, you're shutting off the hamstring by pressing into the ball. So now you're only getting the glute. And Britt is doing a good job of demonstrating that.
Thanks, Britt. You can relax your booty now. So what would you recommend for some of our dancers in regards to the warm-up, right? I feel like a dancer myself, I sometimes don't warm up. I just like go to class and I'm like, oh, what we do at the ballet bar is my warm-up. You know, would you recommend stretching beforehand or a dynamic warm-up or any of these exercises? What do you guys think is best?
Yeah. So one thing I find that I grew up doing in dance class, and some of my dance teachers trained us doing, which is what not to do, is actually going straight for those big kicks. A lot of dancers want to go, when they think about stretching, they just want to go straight into the stretch, do a huge kick up, and that's how we tear everything. That's bringing our muscles from a contracted state to that fully lengthened state, which is actually makes us a little more prone to injury. So I found that even just warming the heart rate or getting the heart rate up, anything between kicking your butt, little butt kicks, or doing, honestly, even a little, people laughed at me all the time growing up, but I used to do a little jog around the room several times just to get the heart rate up. Yeah. And then now that you felt that your heart rate is up and everything is, your muscles are at least a little warmer than they were before, then that's when you can do some more dynamic stretches instead of pulling everything straight into that length position, just to get everything warmed up a little better and the muscles to react in a quicker way, a quicker fashion.
Got it. Thanks. So you guys talked about cross training, right? How often do you think someone should actually cross change? Cross
I think you should, depending on how many days you're dancing, I think it should probably be three times a week. What would you say, Britt?
Yeah, around 3 times a week. And honestly, we talk about to all our patients here also in terms of dosage.
Yeah.
We know that if you go through an entire cross training program, it's going to take a while, right? It's going to take like what, half an hour, an hour. But even if you target different muscle groups a day, so you're not doing the same thing every day just to get something in there, and it doesn't have to be a long program. Even a few core exercises, a few glute exercises a day can make a difference as opposed to nothing. Anything is better than nothing is what I tell all my patients, because a lot of times people don't want to be compliant with their home exercise program. They're like, this is taking too much time out of my day. I have a full-time job. There's no time for PT exercises. I'm like, well, yeah, we have an hour-long program, but if you just pick and choose anything from that list, that is better than nothing.
Good point.
Thanks. Do you have any suggestions on agility or plyometric exercises that we can do at home? I know we didn't really talk about it too much, but just any recommendations that you guys can make?
So some of the agility exercises, kind of like any quick step kind of motion. So whether you pull out a ladder and you go forward and back, or even if you do that without a ladder, just putting tape on the floor and trying some of that, that can be beneficial. Some plyometric stuff, just making sure you honestly go in that order to warming up and doing your strengthening exercises before that. Usually I like starting with double leg jumps before I go straight to the single leg jumps. And I know a lot of our dance activities are on that single leg, but little light box jumps if you want, just to strengthen the quads, the glutes. And then moving more towards those single leg jumps, such as those skater jumps, any jumps in diagonal, or even mimicking some of your grand jetés in class.
Great, thanks. So Kristen is a point shoe fitter, and she says that she sees a lot of kids who don't have the appropriate ankle flexibility. Do you guys have any suggestions on exercises for those dancers?
Yeah. So we have a, should we demonstrate?
Yeah.
Okay.
That'd be great.
So should we turn the demo camera back on? Okay. So something that we really like to do, in terms of, you want to do the assisted Muligan move, you could do it with like a friend, the interdorsal flexion. Yep. And then, okay, so basically, let me just come to the camera so I can explain it first. So basically, if dancers don't have a lot of range into plantar flexion, sometimes initiating the movement into the opposite direction will sometimes help. And so what I like to do for my dancers is I like to work on both directions of the range of motion. So your ankle bone has to glide back in plie and forward when you point it. So I usually like to do a combination of these sort of mobilizations and strengthening techniques to help. So basically you can do it on your own, you can do it with a friend. On your own, you're gonna come right below your ankle bones, and you're gonna put your hand there and apply a pressure backwards, and then you're just gonna lean into it, and you'll feel the bone move back. But that's just to kind of like increase range of motion in the joint. And then, Britt, you want to explain just near the camera, I guess.
So you can also use a band to kind of help out with that, instead of using your hand. So you're going to place it right, if you flex and point your foot, you can kind of feel a bone kind of pop into your hand. So if you place that band right there, are you doing the flex one? And you pull it out, and you can anchor it. You don't need a friend for this. Even if you anchor it against the edge of your bed that doesn't move, or if you anchor it, I like saying a stable table, because you'd be surprised how many people tie it to a table that has nothing on it, and the table comes with them. A stable table with anything on it, then you can kind of move into that dorsiflex position in sitting.
And so that's going to help do the opposite of that motion that is required for obviously point shoe fitting. Obviously the motion that's required is what we call plantar flexion. So we are going to be strengthening into plantar flexion by wrapping the band the other way and you're just gonna press down with your ankle and then come all the way back up. And this helps to build the back calf muscle, right? And it really helps the dancer articulate through their feet and make sure the muscle is strong within the full range of motion. So that's to strengthen.
Can everyone see that on the camera, by the way? I know we're a little far back.
It's a little far, but I think we get the gist. Yeah, thank you guys for demonstrating that. I feel like I had a follow-up question to that, but if I think of it, I'll let you know. But there's another participant, Alexander, who was asking, what do you consider tolerable pain for or difficulty for dancers? What's a good way for dancers to gauge that? Because a lot of dancers like to push through things when we probably shouldn't.
I would say that, and Britt, you can like, I would say that if there's any pain with like walking, like significant, like above, if you were to rate it on a scale of 0 to 10, 0 being absolutely no pain and 10 being ER. If you're above like a 4, I'd say you need to, that's more of like a flag of like, it could be an injury. And then also, the nature of the pain. So is it sharp? Is it dull and achy? Is it shooting? Is it burning? Like keep those things in mind, because usually a soreness will be dull, achy for like 24 to 48 hours and go away. And it might be present when you walk, but it's going to be like a 1, right? Versus like if you have like a stress fracture in your foot, it's like a bone, like a dull, achy bone pain that's there all the time, especially when walking. And so that's a good way to gauge.
And also thinking about what may have caused you to feel this way. A lot of dancers know when they've danced for a long period of time, then they feel sore the next day and then it goes away. So if it's anything that's not in that kind of realm, if you're feeling sore after 4 days, or doesn't have to coincide with anything. So say you've been dancing 3 hours a day for the past 10 years, and now you're feeling soreness after that 5th day, but you didn't do anything to increase the intensity, the same amount of time you've danced, and nothing's really changed. You're doing the same routine, and then you're feeling something that you haven't felt before. It's 4 days later versus the 2 days later where your soreness has gone away and nothing's changed. So knowing that too, if something's not, when something's not right, if you can't think of anything that kind of would have caused that increase in soreness over that period of time, or maybe you did do something and you're like, oh, I went through this I did this large jump and I fell, then considering that it may be a little more of that on that injury side than just soreness.
Good points. Thank you, guys. Does anyone else have any other questions? Just want to kind of open it up to anyone that's watching us on Zoom or via YouTube to see if they have any additional questions. We'll give them another moment or two. Is there a way to stretch out your shin muscles? Thank you, Michael.
Yeah, should we put demo back?
Yeah, we put the demo.
It's kind of, so a way to stretch your shin muscles is pretty much how me and Britt are sitting right now. So this is my go-to. Basically, all you're doing is you're sitting back on your heels with your feet pointed, and you just sit back on your heels and you kind of like rock backwards. So you rock so that the balls of the top of your foot is all the weight is on the top of your foot, and you feel a stretch there. You can also just cross one leg over the other and you can just pull it. You can just, I guess, this way. And then you just pull your foot down. So you're stretching the top of your shin.
Great, thank you guys. Appreciate the updated exercises that you threw in at the end over there. So to all of our attendees, thank you all so much for your thoughtful questions and for attending our webinar this evening. I hope that you all found value in what we had to discuss today. So if we didn't get to answer your question, or if there are any questions that pop up as your day goes on, Please feel free to reach out to Brittany or to Allison. Their contact information is listed there. So again, your presenters today were Brittany and Allison. Both are located here at our Times Square office. Go ahead and jot down their contact information if you would like to reach out to them directly with any questions, or if you'd like to schedule an appointment with them. I was your host. My name again is Nina Augustin Rodriguez, physical therapist and clinical director here at our Times Square office. And then Jamie Kinkler, thank you so much for helping us with our Q&A portion. She's a physical therapist and the assistant clinical director at our Chelsea office. Feel free to reach out to myself or Jamie as well if you have any questions. We are happy to facilitate getting you set up with one of our great therapists. At Sphere, we treat an array of conditions from head to toe. And as a reminder, we're open for in-person visits as well as for telehealth sessions. Should you feel that you could benefit from some individualized guidance and treatment, please don't hesitate to reach out to any one of us individually, and we'll personally coordinate you being set up with one of our team members for an evaluation. Lastly, we will be continuing our webinar series throughout 2022, covering a variety of topics. We look forward to seeing you there. Please follow us on social media and or check your inboxes to learn more about upcoming topics and the schedule. Thank you all so much for spending time with us today. We hope that you enjoyed our